Currently, Hispanics are the largest ethnic group in the country, and by 2125, Hispanics will surpass non-Hispanic whites in the U.S. Each year, approximately 1.5 million new Latinos come to the U.S. via immigration, and new children are born to Latino families. Hi, I'm Dr. Elena Rios. By the year 1970, Latinos made up 5% of the total U.S. population. By the year 2010, that figure increased to 16%, or 50 million Latinos. Today, estimates are that by the year 2035, that figure will rise again to 20%. And if projections are correct, by the year 2042, 1 out of 4 Americans will be Hispanic. Welcome to Washington, D.C., our nation's capital, headquarters of the National Hispanic Medical Association. Established in 1994, we represent over 36,000 licensed Hispanic physicians in the U.S. In the 90s, a group of physicians, leaders, and health advocates, true pioneers, stepped up to the plate to meet the challenges of our growing U.S. Latino population.
We are different, and we are going to create an organization that is very different and that will really advocate as well as produce the science and the services of high quality that we need to produce to better serve our communities and our nation.
So began the formation of NHMA, a national membership association organized to provide leadership to improve our U.S. healthcare system.
I've watched this organization from its inception in the early 90s, and what it's grown to be, and the respect that you have, the impact that you're having is tremendous. And a lot of that is just to the hard work of the people on the board, the individuals, and especially Elena, who's been doing it so much.
In 1994, for the first time, a national network of Hispanic physicians was established. Doctors who shared a vision and commitment to develop federal policy, programs, and advocacy.
So when we define our agenda, I say to you, you don't get so specific, don't be so surgical that you forget the big picture.
NHMA's agenda includes expanding access to quality health care, increasing diversity in medical education, cultural competence, and research for Latinos.
As part of an organization like the National Hispanic Medical Association, you've dedicated yourselves to improving the health of Hispanic populations around the country, and you've dedicated yourself to putting an end to health disparities. We need your voices out in your communities, getting people the facts and explaining exactly what the improvements of the last several years have meant for them.
Today, NHMA is a rapidly growing national resource of emerging knowledge.
First of all, the President and the Secretary send their regards. They knew I was coming, and certainly wish you a very successful conference. And as you probably are all aware, they are very, very supportive of many of the initiatives here. I know that they look to Elena, the staff at the White House, especially when it involves Latino issues. And you know, the NHMA has really become a pivotal organization nationally as far as health.
NHMA works closely and in partnership with the federal government and Congress, the private sector, private foundations, and national Hispanic organizations. In 2002, NHMA and the Congressional Hispanic Caucus convened the National Hispanic Health Leadership Summit with the Department of Health and Human Services, the Robert Wood Johnson Foundation, Senators Frist and Hutchinson, and others. 170 health experts developed recommendations to improve health care in America for the next 5 years.
I think that this summit is going to position the NHMA in a position to be the national authority on medical issues.
Through its Leadership Fellowship program, affiliated with NYU's Wagner Graduate School of Public Service, NHMA continually promotes leadership development.
I became a fellow in 1999, and I was a graduate of the first group. It has completely moved and changed my career. The first time I came as a fellow, I heard about the Centers of Excellence, and I said, why not us in New York? And now about 3 years later, we have a center of excellence. It's made a huge difference.
To date, over 200 NHMA physicians have acquired the knowledge and skills necessary to take leadership roles in the health system at local, state, and national levels. Medical residents have been trained through the Resident Leadership Program and NHMA's mentorship programs with academic and private practice doctors.
I just want to let everyone know that NHMA is very dear to my heart. So it's been a long journey for me, but I'm really grateful for the opportunity to be mentored by you.
During the second annual Hispanic Health Professional Student Scholarship Dinner, held in New York City in December 2005, scholarships were awarded to medical, dental, nursing, public health, and public policy students for their exceptional academic performance, leadership, and commitment to their community.
I want to thank the National Hispanic Medical Association and the National Hispanic Health Foundation for recognizing my work and providing me with the scholarship, which is definitely nice, especially going to medical school, which is very expensive. Mildred Soto and Elizabeth Lee and Nelly Correa, because at the medical school, they're really the driving force to ensure that Hispanics are well represented and our health issues are brought up. And I think that we need to acknowledge and recognize that to keep them empowered.
Compared to all other groups, Latinos are the greatest proportion of uninsured in this country. In 2003, NHMA was awarded a congressional earmark to develop a Hispanic Health Professions Leadership Network and the National Hispanic Health Foundation. In 2005, presidents of 14 state and local Hispanic medical societies met and developed agreements establishing the NHMA Council of Medical Societies. I would like to invite you to our national and regional conferences to educate and mentor health professionals who want to improve preventive services and the health and well-being of all Americans. The future quality of life depends on us working together.